Hi, welcome back. Here we will learn how working mothers can continue breastfeeding for their children. So, breastfeeding in working mothers. This is the Senator Larissa Waters, who is breastfeeding her daughter in the Australian Parliament. What are the challenges faced by working mothers? They are unable to maintain a work-life balance. They may have emotional and mental health challenges for continuing breastfeeding. There may be constant guilt and anxiety in the conscience of all working mothers. Sometimes family may question their priorities. Sometimes it may be difficult in finding affordable quality child care. Sometimes they may be forced to use formula feeds. The work environment may be unsupportive. There may be little or no paid family leave after delivery. The employer may not offer breastfeeding support or flexible schedule. The workplace may discriminate against new mothers, and there may be lack of area, facility, and privacy to express breast milk. So we always see in media some great people, mothers who are breastfeeding, who are continuing their care of their children in their public life also, like this Swedish politician who is taking care of her young son. In our country, we have what is called the Maternity Benefit Amendment Act 2017, which gives mothers time for exclusive breastfeeding of the child in the first 6 months after their delivery, and mothers will get time to recuperate before she gets back to work. And it also facilitates adoption. It also allows a facility of nursery to take care of the children, that is the crèche facility, and it permits her to look after the child even during work hour with this crèche facility. And the health concerns of the mother is also taken care of in this act. So here it allows almost 6 months of maternity leave for the first two children, and 3 months for adopted child, and 3 months for any children beyond the first two. The Maternity Benefit Act requires employer to provide nursing breaks of prescribed duration for new mothers in order to express breast milk for their nursing child. And these nursing breaks are fully paid and are available until a child reaches an age of 15 months, and the duration of these prescribed break is not under the Act. And it has expanded the maternity leave period from 3 months to 6 months. And every establishment having 50 or more employees are required to have a facility of crèche within such a distance as proposed, either separately or along with common facilities. A woman worker will be allowed 4 visits to the crèche in a day. In 2018, the Government of India has modified the law act and allowed one crèche for every 30 children between 6 months to 6 years of all types of employees. And crèche must be located at the workplace or within 500 meters of the establishment. The employees are required to employ one crèche worker along with a helper for every 10 children under the age of 3 years and for every 20 children between the age of 3 to 6 years. Here you can see another photograph of a member of parliament attending the European Parliament with her child. So what is the solution for working mothers? Let's see. Traveling can be done together with the child, or it can happen being apart. The timing of return to the job may be extended. So consider extending the maternity leave to 6 months to promote exclusive breastfeeding for 6 months. Try to schedule the first day back on Wednesday or Thursday. A short first week with a weekend around the corner will make for a smoother transition. Shift the residence near to the workplace. That is also possible. The working hours may be made part-time, and there can be rearrangement of the timing of work, and an caregiver can be arranged. There can be individualized care or like a crutch facility, infant care center, the express breast milk, and even milk banks may be needed. This is a photograph of a member of parliament from Spain who is taking care of her child in the parliament. So even though it takes a little extra effort to continue breastfeeding when you return to work, the benefits gained far outweigh the short-term inconveniences. So what happens if the mother is separated from the baby as she joins to the work? So this is studied in detail by Dr. Harry Harlow, who is an American psychologist, who is known for his maternal separation, dependency need, and social isolation experiment on rhesus monkeys. To understand the importance of caregiving and companionship to the social and cognitive development of the child. So the rhesus monkeys were studied in the first 90 days, and the 90 days is equivalent to 1.5 years of the human babies. That is exactly the time taken for the hippocampus to develop, where the explicit memory is stored. The intervention involves a small group of infant rhesus monkeys who were completely isolated, and later on they were found to grow into monkeys who were severely depressed, who did self-mutilation, and who underwent early death. Intervention also included growing newborn rhesus monkeys with non-living surrogate mothers. And the non-living surrogate mothers were of two types. One is those made of steel bar, and the other made up of soft woolen cloth. And the outcome was that these monkeys, when they grew into adults, they avoided the company of other monkeys, confined to solitary lifestyle, and had definite social deficits. And those monkey infants who were grown with bare wire mother, who were separated from their mother and grown with bare wire mother surrogate with held feed, were more aggressive and fearful compared to monkeys grown with clothed surrogate mother. And the monkeys who were grown with clothed wooden surrogate mother withheld no feed, withheld feed and as well as no feed. They were more aggressive and fearful compared to monkeys grown with living mothers. So touch from the clothed mother was preferred more than the feed. So the infant used to prefer the mother surrogate, which was covered with wooden cloth, rather than the steel bare wire mother surrogate. So affection is most important. Dr. Harlow concluded from follow-up studies that there was much more to the mother-infant relationship than just milk. So touch is essential for the psychological and development and health of the infant monkeys and children. And then there was a group where the rhesus monkey infants were grown with their mother, but there was no playmates. So here also he found that these babies also grew into adults who had fear and aggressiveness towards others, but not to the extent as those infants who were grown with mother surrogates. So now we have realized that having the mother or a companion is important for the psychological development of the baby. What about father? These are records from the Criminal Bureau of America. So they have found that having a father is also important. So youth from fatherless homes constituted 63% of suicides, youth suicide. And fatherless homes contributed to most of the rapists, at least 80%. So that's 14 times the average. And they also had high school dropouts. 70% of them drop out from school as per the National Principals Association report. Then 75% of all adolescent patients in chemical abuse centers were from fatherless homes, and 70% of youths in state-operated institutions come from fatherless homes, and 85% of all youths in prison came from fatherless homes. That is at least 20 times the average. So having a father is also important so that the child or the growing adolescent gets a direction, a civilized direction in his life or her life. And apart from that, there is an increased incidence of addiction to various stimuli like food, drugs, sex, porn, work, even exercise in children who were separated from their parents. So what really turns our kids into addicts is the children who suffer are those who were closer to their friends than their parents, as per Dr. Gaber Mate, who is a Canadian physician, specializes in trauma, addiction, stress, and childhood development. So in the Dr. Harlow's experiment, one is the open field test. In this experiment, an infant was placed in a novel environment with novel object, and when the infant's surrogate mother was present, it clung to her, but then began venturing off to explore. If frightened, the infant ran back to the surrogate mother and clung to her for a time before venturing out again. But without the surrogate mother's presence, the monkeys were paralyzed with fear and huddled in a ball and sucking their thumbs. So, so absence of mother can lead to more of thumb sucking in the later part of their life. So this is the open field test where you can see the infant is with the mother surrogate and it is clinging to the mother surrogate and it is trying to explore the surrounding. However, if the mother surrogate is not there, then the infant curls up like a ball and it does not explore the surrounding. Then there is a fear test that was conducted where the infants were presented with a fearful stimulus, often a noise-making teddy bear. Without the mother, the infant covered and avoided the object, whereas when the surrogate mother was present, which is a non-living object, the infant did not show great fearful responses and often contacted the device, exploring and attacking it. So this was the stimuli used for the fear test, which is a toy which gives the infant a fearful stimuli. So similar to rhesus monkeys, the human babies also develop in a similar way, and up till 7 months, the baby goes to any stranger, and after 7 months, the child starts to fear and shows stranger anxiety. And this shows that the child starts to remember the face of familiar people, and who are non-familiar, the child has fear to strangers. So stranger anxiety and anger, temper tantrum is also seen from around 7 months, 5 months to 5 years. So once the memory is developed, the child starts to have fear and anger, which is much like a reptile. Reptiles also show fear and anger, and they do not have any social association between the different members of the species. Now, after 1.5 years, the memory is totally developed, and before 1.5 years, if the baby is in contact with the mother, then the fear and anger is easily mitigated, and the baby starts to explore the environment. And especially before 4 years, the baby should be exposed to more of the societal members so that the baby can develop friendship. And without the presence of mother, the baby may not have compassion and empathy, and will have more of addiction. So this is how, as psychologically, we develop into a mammal because of the presence of our mothers. So when you're separated from your baby, yes, you may have to depend on somebody else to take care of your baby. It's better that that somebody else is your family member, a grandma will suit that role ideally. So express your milk and store. Feed the baby with a sterile cup, and because bottle feeding is may be a source of infection in tropical countries like India, and continue cuddling the baby by the person who is taking care of the baby, grandmothers or a similar person, and allow the baby to suck at its own fingers, that is to calm the baby's mind, or the baby can suckle at the grandmother also, and or any other female relative, woman relative, and calm the baby when the baby is crying, and play and communicate gently with the baby, and protect the sleep of the baby. So this is another picture of New Zealand Prime Minister Jacinda Ardern. She is the first female world leader to bring her baby, 3-month-old, to the United Nations General Assembly. So expression of breast milk is important. It can be done with the hand or using the pump. When you are using hand, you have to sterilize the container by washing with soap and water, then with warm water, and then submerge in boiling water for 15 minutes. Then you shake off the water and do not wipe the container. Keep it straight, let it dry, and then you can express your milk. Wash your hands with soap and water. Then gently massage your breast, and bring the milk towards center. Place your thumb and index finger opposite just outside the areola. Then push the thumb and fingers backwards towards the chest, and then gently squeeze inwards to get the milk out. And repeat the step 5 at positions around the areola. That is how you express using your hand. Now, using your pump, it can be a manual pump or a electrical pump. Again, you have to wash your hands and dry well, and wash and sterilize and assemble the pump. And sterilization here means again to remove each container, each parts of the pump, and wash with soap and water, then with warm water, and then submerge in boiling water. Or you can keep in a steam sterilizer for at least 6 minutes. If it's boiling water, you have to submerge for at least 15 minutes. Then allow to dry, and have a trial run and practice using it, and then start with low suction and then slowly increase, and try expressing one breast while the baby is feeding on the other. That's a good idea. And so you can use a manual pump or an electrical pump. And if it's an electrical pump, you can start with a lower pressure and then gradually increase the pressure. And you can also do pumping while feeding on the other side, feeding the baby on the other side. Once you get the milk, you can store the milk, use milk storage bags or clean food grade containers, sterilized containers. Avoid plastics containing bisphenol A. And so you can have storage bags or stainless steel container for storing the milk. And if it is in the room temperature, you can store up to 4 hours. In the fridge, you can store up to 4 days. And in the freezer, that's the deep freezer where the temperature can go up to minus 18 degrees Celsius, you can store up to 6 to 12 months. So once you have frozen it, you may have to thaw it. And after thawing, you may again keep it for 1 to 2 hours in room temperature, or up to 1 day in a refrigerator, but never refreeze the thawed milk. And if you have leftover milk after feeding, use within 2 hours after the baby is finished feeding. So at room temperature, you can store till 4 hours, and in fridge you can store till 4 days. In a cooler you can store till 24 hours. In a deep freezer you can store till 12 months. Always label the milk with the date it was expressed and the child's name if you are using it in an ICU or a child care facility. Freeze the milk in small amounts of 2 to 4 ounces to avoid wasting. Store the milk in the back of the freezer or the refrigerator and not at the door. If you don't plan to use freshly expressed milk within 4 days, freeze it right away. Milk can be stored in insulated cooler bag with frozen ice pack for up to 24 hours when you are traveling. Thawing. So always thaw the oldest frozen milk first. Thaw the milk under lukewarm running water in a container of lukewarm water or overnight in the refrigerator. Never thaw or heat milk in a microwave because microwave destroys nutrients and create hot spot which can burn a baby's mouth. So avoid using microwave to warm the frozen milk. Use the milk within 24 hours of thawing in the refrigerator. So the time is from the time it is completely thawed and not from the time when you took it out of the freezer. Use the thawed milk within 2 hours of bringing to room temperature or warming, and never refreeze a thawed milk. While feeding, it can be served at room temperature or warm. And to heat the milk, place the sealed container into a bowl of warm water or hold under warm running water. Do not heat milk directly on the stove or in microwave. Test the temperature before feeding it to your baby by putting a few drops on your wrist. It should feel warm and not hot. Swirl the milk to mix the fat which may have separated. If your baby did not finish the bottle, leftover milk should be used within 2 hours. Now, sterilizing. Sterilizing means you have to kill the bacteria. That is both for the feeding utensil as well as for the breast pump. Disassemble the pump and the feeding part in a clean basin with soap and water. Do not wash directly in the sink because the germs in the sink could contaminate the items. Rinse through under running water and air dry items on a clean dish towel or paper towel. Now use the clean hand and store the dry item in a clean protected area. But you have to sterilize it. For sterilizing, you have to keep the container in a boiling water, submerged in boiling water for at least 15 minutes, or you can use a steam sterilizer for at least 6 minutes. And milk banks also may help working mothers because artificial formula never provides the broad range of benefit of a human milk. Given the high rate of preterm birth in the country and the level of malnutrition that ensues in the postnatal growth in such babies, there is an urgent need to have milk banks across the country. Now, even if you are working nurse or doctor, when you come from your home, before coming, you can feed your baby, and at your workplace, you can express the milk using electrical pump or a manual pump for at least 20 minutes, and then you can store it in sterile container. Then if you are reusing it, you can wash it and again sterilize and again start pumping after working for hours for again one more 20 minutes. So during the work hour, you can at least use the breast pump and express your milk at least twice in a working schedule, twice for at least 20 minutes each duration. And once you return home, you can again feed your baby. So similarly, when you go out, before you go out for work, you can feed your baby. And maybe if you are driving, you can use the electrical pump to automatically express your milk and then store it from the pump to a container, then do your work, and then again express your milk after 3 hours or 2 to 3 hours for another 20 minutes, and then repeat the process. And once you reach the home, you can give the express milk as well as feed the baby directly. That is how you can maintain the breastfeeding in case you're working. Now, what are the options to working mothers? You can continue express breast milk as long as possible before resuming to work, and take the baby to daycare center at workplace and feed in between the work. Change the workplace to a nearby place or vice versa. Express and keep the express breast milk when the mother is away. Breastfeed before leaving to work, on returning from work, and during night and holidays, and extend the maternity leave till 6 months or avail half pay or loss of pay and leave if possible. So when you are separated from your baby, of course, you will need help from your grandmother, from the grandmother of the child. You will have to extract your milk and store and feed the baby with sterile cup. Avoid bottle feeds and continue cuddling the baby by the grandmother or the woman relatives. Then allow baby to suck at its own fingers or at the grandmother. Calm the baby when the baby is crying. Play and communicate gently with the baby and protect the sleep of the baby. So success in breastfeeding is not the sole responsibility of a woman, of the mother. It's the promotion of breastfeeding is a collective societal responsibility. So this is another picture showing the plenary session in European Parliament where the member has taken her daughter during a voting session. And so let's treat the mother and the baby humanely and let the mother take her baby to work if possible. And because we are all mammals and we are not machines or reptiles. So let's treat the mother and baby as humans, and we are mammals and we are neither machines nor reptiles. Thank you for your patient listening. I hope you understood the essence